They're calling it the diabetes epidemic, from 2.1 million sufferers 10 years ago to 3.3 million now. The number of diagnoses is spiralling, and the costs are too. The NHS already spends £10 billion a year on the disease, mostly on the knock-on health problems.
The complications are harrowing for the patient and in terms of cost terms, amputations, heart attacks, strokes, blindness. And the problem is if diabetes isn't treated early, that's when you get the complications.
Type 2 diabetes, the most common, is a lifestyle disease. Rates are rising in line with obesity. Robin Swindell is the first to admit he was overweight and didn't exercise when he was diagnosed 2 years ago. He's transformed his habits, lost 8 stone, and with constant monitoring of blood sugar levels and staying healthy, he keeps his diabetes under control. But he says he hasn't had enough help.
I had a 7-minute consultation with my doctor. I was prescribed some medication, told to lose some weight and come back in 2 months' time. I wasn't even told what sort of diabetes I had. I wasn't told about the sort of diet I needed to adopt or the potential for complications. I was left very scared afterwards.
And while that prompted Robin to make big changes himself, Diabetes UK warn not everyone will do so. To make matters worse, many just aren't getting the regular medical checks they need.
A third of all people with diabetes, so that's over 1 million people, aren't getting those simple checks every year. So they're not keeping their diabetes under control, they're not being helped to keep it under control, and the cost of treating the complications that come from not having really well-controlled diabetes is nearly bankrupting the NHS.
He would if he could, but Robin can't turn back the clock and change his diagnosis. He can try to prevent the complications. Unless other patients and the NHS do the same, it'll cost lives and money.